Hello, everybody. My name is Anthony Mayer. We probably still have a few people coming on board, but I think they'll just have to catch up to us. So, welcome to this Monday, the 6th of April, 2020. This is a meeting held by the Rotary eClub of Latitude 38 for District 9820, Victoria, Australia. Tonight, before we start this event, I would like to just check in with you all that this event will be recorded and will be available to live stream within 24 hours on the Rotary eClub of Latitude 38's Facebook page. Please, if you've got any questions, just write the questions down in the chat window and I will do my best to aggregate any common questions to ask Michael. We would have had this as an open session or as a webinar. We were just unable to get that going, and you'll appreciate that your mics are turned off because we can't have 70 people trying to talk over. It would just be a bit hard to do. Please be mindful of video conferencing etiquette. The light behind you or the camera where it is, microphones are turned off, but if they do get turned on, be mindful of background noise, TVs, etc. And be mindful of what your camera is taking a picture of. Remember that this is a recorded event. If you like, you can turn your camera off when you don't like. The approximate timeline, we are now running 15 minutes late. I do apologise for that, with now 3 more people just coming in. We are up to 75, 2 people just left, down to 73. Our speaker, Michael, will speak for about 10 minutes. And the idea of this session is really to take questions. So he'll talk to us about what we've got on tonight and about the coronavirus situation. And then there'll be time for questions. So I'll just start. Obviously, the World Health Organization announced that COVID-19 is a pandemic, and the Australian government has published recommendations to help us slow the spread of the COVID-19 virus in Australia. Together we can help slow that spread and stay healthy by keeping up to date and getting information that's credible. We do that by going to health.gov.au and dhhs.vic.gov.au for credible information. Today, Michael Schilling is going to talk to us. He's a Cardinia Shire Councillor in West Gippsland and Victoria, and is a hospital nurse on the front line. Michael's going to speak about the current DHHS guidelines. Obviously, they change every day, or have been, or almost. And we're going to have an open discussion about the current state of play during this COVID-19 pandemic and how it will impact Rotarians and their families. So thank you for joining us today. And I would very much like to welcome Michael.
Thank you very much, Anthony, for inviting me to this meeting, and welcome everyone. Thank you for coming along. I was invited by one of your members from Pakenham, Vivian, to come and speak today. And little did I expect that it would be such a great turnout. We've had to adapt very quickly in this world over the past few weeks, and in a lot of ways, your online Rotary Club is sort of already there with the technology doing things virtually. I was involved for the first time with the online Rotary Club, Latitude 38, I think probably about a year ago now, and one of our members, Vivian Armstrong, and a few locals wanted to start up a library for kids at our local parks, portable libraries. So we sort of collaborated together, and through the hard work of the club, we managed to put a library up in our neighbourhood village, which I happen to live opposite. So it's been fantastic to be able to see people use that library, and it's, I think there's definitely plans to spread them throughout our community. So I was invited here today. I sort of live in 2 very different worlds. I live in a local government world where we're protecting the community and community against COVID-19, and we're implementing measures to limit the spread. And we're it's not business as usual. We can't say that during a pandemic, but we are certainly adapting to how we work and how we live. And I've never spent so many times on Zoom and on Skype for business, speaking to residents and conducting our meetings. So it's just something we've all had to do. And then my other world that I live in is I work as a nurse within a public emergency department. And I have to say, just from the beginning, that I'm not authorised to speak on behalf of my healthcare organisation, but I can certainly talk more generally about healthcare and from my own personal knowledge base as well. So I have a world where we are sort of closing down to limit social contact, and then my other world, I work in an area that is very much functioning as it should, and it's also looking at increasing services and increasing capacity to be able to deal with any sort of pandemic, which obviously we're, as a community, we're in right now. I'm very aware that tonight should be as interactive as possible, and people asking as many questions as they can. But I'd just like to stress a few really important things around COVID-19, as we're hearing a lot in the media. There's a lot on social media. We're seeing people in the community quite anxious, quite stressed about this situation. But it's really, really important that as a community that we seek information from factual sources. So we have the news, we have social media. There's only one place that you really need to look for information, and that is the DHHS website, Department of Health and Human Services, which there is a screen that will be up, which has all of the relevant guidelines about what you need to do. It's all factual, and anything that we say tonight, this is a very moving feast, which is changing rapidly. So information is constantly changing. So as long as we're keeping up to date with the most relevant information, as a community, we can give ourselves the best chance of protecting ourselves against this pandemic that is COVID-19. We also need to make sure as a community that we're looking after ourselves. There are members in the community that are seen as being more vulnerable than others when it comes to this, and there have been very strict guidelines put in place by the state government to try and protect the community against mass infection of this virus. But it's really important that we do get together and we really do look after each other. And I've been encouraging people in my community, and I can see from the chat on my Zoom screen that there are a number of people from the Cardinia Shire on here tonight, and neighbouring Casey as well, I can see, which is fantastic. But I've been encouraging people in the community to group together in a way of identifying some vulnerable people, some people that potentially shouldn't be even leaving their homes for things like groceries. And you know, when you are at the supermarket, just checking in and seeing, hey, what can you do? What can you do for your neighbours, and what can you do for each other? I also think that it's really important as we sift through the information that it can be all-consuming, COVID-19. There's nowhere that we look in the media where it's not in our face. There's nowhere where we go out in the community where we are not faced with it in some ways. It's common conversation wherever you go, but it's important to have an outlet where you're keeping informed still, by all means, looking at the DHHS website, consuming information from reliable sources, but also having the ability to be able to disconnect and enjoy your hobbies and be able to, I guess, maintain a little bit of normality in quite uncertain times in the community. Like I said, I'll try very hard to answer questions tonight, and those that I can't answer, I'll take on notice if that's okay, and I'll be able to feed that information back. But I'll try and give the best overview possible of local government response and hospital response as people need that information. I guess I can just very briefly, I know I've only got 10 minutes, I might just spend a minute talking about the healthcare system and council and local government. I'll start with local government because I've just come back from my virtual council briefing, so it's very fresh on my mind. At the moment, councils are really working in the community to look at ways that we can limit contact with one another, particularly in large groups, as we're not allowed to be in large groups together. So I know Cardinia and all other councils have done the same. We've had to make the difficult decision of closing down playgrounds, and I have a little 5-year-old at home who said to me, "It's really nasty how council have closed down all the playgrounds, isn't it?" And it's a tough time. It's the middle of school holidays, and schools probably inevitably would have closed. So we're doing things like that. So places that councils manage, like aquatic facilities, council-owned facilities, we're able to implement those strict measures quite easily. Then there's the bigger question of things like rates and collecting revenue as a council. And we're very aware that people are losing income. People have lost their jobs. There's people in my own family. I consider myself one of the lucky ones working on the front line in healthcare, in that I do have a job, but we need to be responsive as local government into looking at people who won't be able to pay their rates, and really being compassionate with our hardship policies and having a really open dialogue and consultation with our community. Council's role has also been very much around giving people reassurance and also linking people to the most up-to-date information as it comes to hand. In terms of healthcare networks, as I said, I won't comment specifically on my own hospital. Healthcare networks obviously are in a stage at the moment where we're probably we hear all about this curve, and we know that if we don't flatten this curve, which is the speed and the rate of infections climbing, we know that hospital beds will be well and truly oversubscribed and at capacity. So it's a job of healthcare networks at the moment to look after the community the best that they can, in terms of making sure that people have access to good healthcare, good screening if you do fit the criteria, if you develop symptoms and the criteria to be diagnosed with COVID-19, but also making sure that our hospitals are responsive to people as they do require those acute care services. So you'll see hospitals around Australia really trying to free up as much capacity as they can in terms of intensive care capacity, and emergency departments really being equipped to deal with the potential influx of patients needing care. And there's a variety of ways that hospitals will do that, and I guess each healthcare network will be receptive based on the community need and I guess the area in which they're servicing. So that was a really basic overview, and I'd be very happy to throw it open to some questions now from our audience. 75 people. I don't think I've sat in a meeting with 75 people before, so this is a great turnout.
So if anybody would like to write some questions in the chat box on the side. I notice we have our district governor on, as well as our Latitude 38's club president, and he might want to say something towards the end. So I'm just shoring you up for that, Adrian. Does anybody have any questions? Just type them in the chat box on the bottom. So pull down on the bottom of the screen and pop up the chat box. And up to date, we have 75 people in the room at the moment.
And may I ask if there are, I can talk more broadly in general while we're waiting for some questions to come in.
So I've just got a question here. I'm sorry, Michael.
No, please go ahead.
To mask or not to mask?
To mask or not to mask? So the current information that we're having is that there isn't need to wear a mask out in the community. And what the government are really recommending is that we just take good basic personal hygiene. And I think it's really important as a community that we really do take that on board, and we really are responsible with our own self-care and also our own personal hygiene. We know that the virus, COVID-19, is an airborne virus, so it can be transmitted, obviously, yes, through the air, but also through contact. So if people are doing the right thing, and we believe that people are definitely listening, and the message is certainly getting through, as long as we're not going out into the community when we are unwell. If we do have a sore throat or a sniffle, we're doing the common courtesy things that you would do anyway if you did have a cold. We should be okay.
Right.
Also, in terms of hand washing, when you have been out, hand-based sanitizers, washing your hands are all very reasonable precautions to take.
So I've got a few coming in hard and fast now. Our local greengrosser is suggesting people wear gloves when choosing fruit and veggies.
Look, I don't think there's been anything put out specifically about that, but once again, something like that would require everyone in the community to do that, wouldn't it? It would require everybody to be wearing gloves. But once again, as long as we need to be washing our vegetables, peeling our vegetables when needed. And also, I think it's just important that if everyone is following hygiene appropriate hygiene, that it should be okay.
I saw a video come through from the US, Michael, of a surgeon who said we treat treat the situation the way they treat pre-surgery. Of when you bring your groceries in, especially if you're bringing stuff to somebody who is at a compromised or at a high risk, that you should create a space that's wiped down and clean. And then, did you see that? It was from a surgeon in the US. I didn't see it. I might find that and share that on our page. It seemed like pretty logical stuff, which was just, it was pretty logical. Wipe down bags. And they were talking about how long the virus can live on things. I'm not sure if that's official yet or not. We've got here, what might stage 4 restrictions look like, Michael?
Look, there hasn't been all that much information around that has come out, but at the moment, obviously we're in stage 3 restrictions. So stage 4 would just further solidify that, I guess, and would put us all on further lockdown. And from my understanding, some of those shops that are currently open, other than your essential Coles and supermarkets, would potentially be the next ones that you would look at closing. But look, I'm not in terms of stage 4. That hasn't been something that council has really been privy to at this point in time. And looking from a healthcare point of view on the front line, it's not something that I have necessarily been faced with in the community, because it's quite different in the acute healthcare environment. So that would be something, as for the details, that I would actually have to look up the reference myself if I was to give accurate information on that.
Okay. Sorry, I've got a few coming through now. In your opinion, do you think that more social restrictions may come in, given that we have slowed may have slowed the curve?
This is a really tough one. This is an ever-evolving feast, and even within my own healthcare environment, we have days where guidelines are rapidly changing, and it's something like a pandemic. It's something that it's almost impossible to be able to predict. So of course there will be different modelling that governments will do, and they will release out to us. There's a chance they could go down that pathway, or there's a chance as the days go on, if it looks like our curves are more and more flattening and it looks like we're having fewer and fewer infections, they might not see the need to do it. So it just depends on, I guess, it's a little bit of a wait and see what happens. Just from the latest updates that the department are sending through at the moment, we are doing quite well. If you're looking at that curve that we see, we are seeing reduced rates of infections each day. And we also have to remember that the bulk amounts of people that have been infected in Victoria are overseas return travellers. So they're saying community transmission is relatively high, but in Victoria it's still under 100. To my information, I haven't seen the latest figures in the last few hours. So I think that it will be important just to be vigilant and just keep up to date with information. And as I know my community has done so well, we just have to be able to adapt with the ever-changing information that we're getting.
Okay. The next question I have here, I read today that lockdown could last till October because of winter. Have you had to put off many council workers?
So this is, once again, this is a work in progress. So our council specifically at this point in time are still finalising all of our budgets. So all that's happened at the moment within our council area, and I can't speak for other local governments, and I know I heard Anthony saying before that there's people that have come as far as Sydney. At the moment, the priority has really been around getting council workers to work from home, work remotely if possible, and also using some strategies around customer service. And we need to be business as usual for our community, particularly with customer service. So we've implemented strategies such as splitting the customer service sites to different council facilities across the Shire to try and limit that contact and be able to implement that social distancing. So the conversations haven't come up yet at this point in time. But look, I can't predict the future, but it's all around the budget at this point in time moving forward.
Michael, someone's got here, sanitizer or plain soap and water?
Nothing will beat soap and water. Nothing will beat soap and water. I was looking at when I went shopping. Obviously, I also live in our community. There is absolutely no liquid soap that you can purchase anymore. But just as effective as that is a bar of soap and a good scrubbing of the hands, singing happy birthday at a slow pace will do the exact same. Obviously, soap and water isn't practical out in the community, so a good alcohol-based sanitizer. And looking to my understanding, anything above that 60-ish% of alcohol is effective against COVID. So I know a lot of people have been keeping sanitizer in their cars or in their bags, which is absolutely fantastic. But at home, soap and water is well and truly adequate.
Thank you. I've got Helen O'Brien, who I think is in Traralgon, says, thank you so much for speaking with us, Michael. We really appreciate your time. I'm wondering if you are proud of your community and community groups in their response of COVID-19.
Very much so. I think in times of crisis, and we've seen it within the bushfires, my community were quite heavily affected last year with the Bunyip bushfires, which we all saw, at very least in the media. The community have gotten together really well, and there's a lot of feel-good posts out on our various pages. It's hard to explain. Cardinia if people are unaware of what Cardinia is like, we have a very urbanized type of built-up area in the growth corridor, and then we also have more rural communities. But within housing estates, they've all got their local Facebook groups. So there are people offering to cook meals for each other. There are people offering to do supermarket runs, take people to their doctor's appointments. I know even within the community, there's been lots of offers for people sewing healthcare workers caps to wear. So there's been an outpour of generosity within the community and looking after each other. And my hope is that when this is all gone, I really hope that some of that still happens, because it has been fantastic to see. And I'm sure a lot of people at this meeting tonight will have similar stories in their communities as well. Yeah.
Thanks, Michael. I've got a message, a question here. Where did it go? Sorry, I've got a few. Seeing that we're told to isolate by government, should government consider using their staff to coordinate community groups like Rotary to support smaller community groups?
Excuse me, sorry. So look, I think that government should be looking down that pathway, yes. There's a lot of things when there's not a pandemic the government simply can't afford to do. And I can talk from local government. So we've had a lot of feedback from communities asking, hey, is it possible for council to be able to deliver Meals on Wheels type services or start something up quite quickly? And the truth is, quite often within departments, there is quite limited capacity. So councils and levels of government really do need to support local groups who actually already do this work anyway. In various different functions. There are groups out there, and I know Rotary are the same in terms of raising money for homelessness and doing the food preparation. So look, I really do feel that government should be 100% should be coordinating local community groups who are already doing this work anyway to really step in and help out.
When you say they should be, is your Shire doing anything to engage Rotary in the assistance aspect of this?
Look, I can't answer for Rotary specifically, but I do know we do have a group in the Shire, particularly around food insecurity. So we have it's like a task force for food. And I do know we have been given advice from our council staff that they have been engaging with that group of people around food. So I couldn't answer specifically around Rotary, but it's a conversation I can definitely have with them. I know we've got a very active online group, obviously, and we also have a Rotary club in Pakenham as well.
So I've got lots of questions here from people. I've got lots of comments from people. Please, if you can, refine your questions, because there's lots of comments here which I don't think will be helpful. So there's a question here from Cheryl saying, I've been following Cardinia Casey confirmed infections, but cannot see the breakdown with these numbers from which are overseas travel versus community transmissions. Do you have those figures?
No, so unfortunately, I don't have those answers. The answers that I have are the ones that are publicly available. But look, I would hope that people who have been told to isolate for that 14-day period, that they are being compliant and they are doing that, not being out in the community, irrespective of how they contracted. the virus.
And I've just got a note here from Adrian Froggatt, who is our district governor. Adrian, I'm happy to unmute you if you'd like to say hello. But he says here that next Tuesday night at 5 p.m, District 9820 will be running a webinar featuring Federal Health Minister Greg Hunt, and that he will circulate more information soon. You there, Adrian?
Yeah, thank you, Anthony. Can you hear me?
Yep.
Yeah, great. Yes, this is hot off the press. We're working on this currently, but we've nailed down a time. Next Tuesday night, 5 p.m, we'll actually have Greg Hunt participating in a webinar, and it's a great opportunity. So we'll send the information out to all Rotarians, and at the time that we send the information out, we'll also be asking you to forward questions. Now, not necessarily will you answer every question, but forward your questions. So we in advance have Greg teed up to answer the things that really concern you.
Thanks, Mike. Thanks, Adrian. Michael, I've got this is a comment here from Marie McPherson saying, loving your positivity, Michael, thank you.
Oh, thank you.
And so are there any other questions for Michael? Please just type them in the chat bar on the side. I'm very curious, I suppose, what can councils or even state government do to stop the panic buying? Are there any processes in place to stop people from doing that?
Look, that's been tough. It's hard because at one hand you can see there's been a lot of anger towards community members who have been panic buying. Look, I don't think anger is at all helpful. People have been frightened, and when people are frightened, people will do what they feel they have to do to be able to get by. Look, I feel that the both state and federal government, just being a resident and sitting back and just observing that aspect of it, have been quite strong in what they've already done around some of that firm language around the panic buying and the need for it not to happen. I think that the best way to stop panic buying is by giving people information, because when people don't have the right information, or they don't have enough information, that's when people draw their own conclusions. And when you have a pandemic happening in your community, it's never more important than to keep people up to date with information and giving people reassurance, as well. It's a vulnerable time in the community. Everyone that I've spoken to have said, I don't remember anything like this ever happening. So I think as long as our leaders keep providing reliable, frequent information to residents, I think that's a great way to do it. And I think we've already seen some reductions in that panic buying just from my own observation, but 100% just keeping information flowing and keeping that honest dialogue between government and our residents.
Helps if I unmute myself. And while we're on that, I would just like to remind people that advice regarding COVID-19 will change regularly, and to stay up to date, you can visit health.gov.au and you can visit dhhs.vic.gov.au for Victorian regulations. The health.gov.au is federal and dhhs.vic.gov.au is Victorian for credible information. Please don't get information from too many other sources that aren't reputable, because I've heard some things that probably aren't reputable. So straight to the source, to the government websites if you need help there. I've got a question here from Judy. Judy says, what is the virus made up of? Probably a pretty open question, but feel free to answer that. Okay.
If there's any virologists or scientists out there, feel free to jump in. To tell you the truth, I don't know the actual makeup of the virus.
I think it's fair to leave that to someone who's a virologist. That's fine. The question.
That's a fantastic question.
It is. Is there a difference between alcohol-based and non-alcohol-based sanitizers?
Look, all I know is that the advice definitely is that alcohol is effective in killing the virus. So I would be hesitant without seeing the evidence in front of me to make comment on non-alcohol based sanitizers, just to be safe in an online forum, not to give wrong information. I just know the evidence around alcohol hand rub, we know is effective. We know it works, but I don't have any knowledge on non-alcohol because within the healthcare network, that's all we use. Lots of alcohol hand rub.
I saw on, I'm not sure where I saw it, it was 60% plus alcohol content for the alcohol wipes.
And remembering that content as well, that's not anything special that you need to get from a pharmacy. I mean, even the cheapest of hand sanitizers that you get at the reject shop or any supermarket, most of them will contain at least 60% alcohol.
Can someone get infected by the virus from an infected person's sweat? Good question. Thank you, Howard. Good question.
Yeah, that is a good question. Look, all the evidence, well, all I can say is from the way that we're protecting ourselves against healthcare, it is very much from the air and from contact. We do know it comes from people's respiratory tracts. So we know that it's very much a respiratory base, but I probably couldn't comment on whether it came from people's sweat. There's a lot of information we still don't know about this virus. It's still, in the world of viruses, COVID-19 is pretty new. So there's a lot of, hello, you got a visitor. So there's a lot of information that we are learning. And a great example of that is we saw in the media today that there's been an animal in New York that's been that's been found positive with COVID-19. So there's a lot around that we still have to find and and learn about. We're really on a learning journey together. And Anthony has frozen.
Sorry about that. I didn't freeze. I just had a interruption from the fur member of my household. I closed the doors and everything. Di Harrison, hi Di, by the way. Di is on the Munich committee with me. Michael, what has surprised you most with people's reactions to COVID-19?
What has surprised me most? Look, I guess working on the front line in an emergency department, I can't say there's been anything that has sort of shocked me. I think that the things that we have seen are quite normal in a time of stress within a community. And I know we can't really liken a health pandemic to a natural disaster, but in terms of people's reactions and just when people are stressed, I've mainly been surprised in a good way. And that is around the community support and people getting together and people checking on each other. And there are little things that I never expected to happen. I mean, I'm a fairly sociable person, and I live within a group of townhouses, and all of a sudden there's a Facebook group that's been started up just for my little group of townhouses for if people need help or anything to look after. So if anything has it's more of a heartwarming experience for the community, being able to come together in a time of crisis.
Great. Does anyone else have any questions that they'd like to ask? We've got another sort of 10 minutes online. So if anybody has any questions, just type them in the box. I'm getting some comments saying, thank you, Michael, great presentation, very helpful.
Thank you.
Robert, I'm not sure, have you brought up gin? I'm
yes,
not
so
sure
there
what
is.
you're asking me, Robert.
So that is true. I can see, sorry.
Methylated spirits, 90%. You can mix it with aloe vera. These are more comments. If you recover, this is a good one. Peter and Petra, if you recover from COVID-19, still people joining. If you recover from COVID-19, are you less likely to catch it again?
So generally speaking, if you have a virus once, that same virus, you generally at a very low chance of getting it again. Once again, with COVID and reinfection, it's a world that we probably we need more information. But generally speaking, in terms of viruses, you are less likely to catch that same virus again. As a general comment.
Okay. Adrian Froggatt says, wine works, have enough and you're no longer worried. Fair enough. That's coming from the top. That's good. Gary Brown says, have you encountered a situation where your views and values conflict with your employer?
I actually haven't. So my healthcare organisation has been on the front foot, and they've been very proactive and supportive of staff. I sort of have a deputy nurse manager role there, so I probably am a little bit more privy to some of the work going on behind the scenes. And I have to say that I can only speak from my point of view, and our healthcare network has been fantastic in supporting staff and working to look after the community. So I'm very lucky that I haven't not been in that situation.
Great, thank you. Does the theory that winter will make our ability to manage COVID-19 harder hold?
Can you repeat that question, sorry?
So, Kerry Schmidt says, hi Michael, does the theory that winter will make our ability to manage COVID-19 harder, does that theory hold?
Look, I haven't really seen much evidence around that at this point in time. It doesn't mean that it doesn't exist. I just haven't come across it. Generally, winter is more challenging with the abundance of viruses, but there's some interesting theories going around with all these people who are socially isolating and as we have to and staying indoors. Who knows what this winter will actually hold in terms of our common respiratory bugs that we would traditionally see a higher prevalence of during those colder months. But yeah, I don't have a specific answer on that.
Okay, it looks like we'll take 2 more questions. I've got 1 more here, and anyone who wants to put the last question in, feel free. Our local hospitals are well resourced in relation to, are our local hospitals well resourced in relation to the number of ventilators and qualified staff? That's from Di Harrison.
I believe that we are. I can't speak from more broadly across Australia, but I'm of the opinion that hospitals are well prepared. In terms of staff, I guess in some respects, I probably am hesitant to use the word lucky, but we have seen this virus first take hold, obviously, in China, and we have seen it spread. So we have been able to see the behavior of it in some respects and see what other countries have done that has worked well and what sort of hasn't potentially worked as well. So I guess with healthcare networks across the country have had that opportunity to have that time where they've been able to mobilize staff and have plans within their medical staff and nursing staff to be able to do this. So from my knowledge and understanding of my local area, I believe that we are well equipped to look after the community.
Cool. Mute. Okay. So I think that's all we've got now. So, Janet McCann, last question, unless there's anyone, someone's saying disinfectant. Oh, that's a good question. Are disinfectant wipes worthwhile? Quick one on that, Michael.
So within the hospital system, we use disinfectant wipes. I haven't done any personal studies or seen any around the ones that you purchase at the supermarket. So that would be a bit of extra research that I would have to do. But I do know that a lot of businesses and a lot of people are using them, but I'm just not sure of the makeup of specific ones and what we would and what would kill the virus and what wouldn't.
I've got 2 questions here that I'll put into one. I'll paraphrase. Are the shires and various councils working together with the thought that if we go to a 4th kind of restriction, like for roads or areas blocked, are the different shires working together on a united front if it gets worse?
So that's very much a council staff thing. So I know, at least at Cardinia, that there's always constant dialogue happening between the various councils. So we have good working relationships with all of our abutting shires, and we work together on a lot of things. So once again, this would take a little bit of an assumption, but staff, I've got no doubt would be working with other shires, particularly around benchmarking and seeing what others are doing.
Cool. Okay, I think that's near. I mean, there's some comments there. Thank you for your comment on brandy, or on Bundy, for some comments there on alcohol being a good sanitizer. A lot of comments from people. Thank you very much. I don't know what that is you've just put up, Helen. Hang on. Looking for LGA figures. So Helen's just put into that. She's sent it to me privately. Helen, if you want to copy that link back into the chat, you can put it in public to everybody. And now there's comments of whiskey. I would like to remind people that the credible information that's out there is on health.gov.au and dhhs.vic.gov.au, and those sites are pretty easy to get to. That's the federal one and the state one. All the information is there. So if you haven't seen those sites, they are the places you should go to for credible information. In closing, I would very much like to thank Michael for coming out tonight and giving us his time. I would like to thank Vivian from our club, and Vivian Armstrong and Grant Ellers from our club, from organising this event. And I think there's no more questions here. Thank you, Adrian. Michael, I can't give you a glass or a virtual glass, but I can virtually tell you to go and have a drink. You've earned it. And thank you very much for presenting to us tonight.
Thank you very much for having me. And keep well and keep safe, everyone.
And I second that. Thank you, everybody. Stay well and keep safe. Remember that talent wins games, but teamwork and intelligence wins championships. And I don't think this thing's going to be over anytime soon. So stay happy, peace out, stay happy and healthy, stay at least 2 meters from each other. And thank you very much again. This will be streamed, this will be recorded and streamed on our Facebook page if anybody would like to rewatch it. Thank you very much. From the eClub of Latitude 38 in District 9820, Victoria, Australia. Peace out and be kind to each other.